Good morning, everyone. I am Dr. Soumava Mukherjee. I am a consultant neurologist working in INK Kolkata. So today we'll be speaking something about epilepsy. Now, epilepsy is a neurological disorder which is quite common actually. Worldwide prevalence of about 70 million people who have been afflicted with this disease, and in my OPD, I see average of 2 to 3 patients with epilepsy every day. What I feel about epilepsy is, as a neurological disease, it's important to understand that epilepsy is defined as a synchronous firing of the neurons which is abnormal, and the motor manifestations are what we call as convulsions. Now these motor manifestations, which are usually seen as what we call as tonic-clonic movements, or in abnormal movements of the hands, or in neck deviation, or frothing from the mouth, or the tongue bite, or bladder incontinence. Now these are the features of some of the most common forms of epilepsy, like the generalized tonic or generalized clonic or even generalized tonic-clonic seizures. What I want to impress on the audience and the patients especially is that there are other forms of convulsions too, and it is important that we appreciate these types of convulsions. Like there can be a subtle staring look, there can be some falls, there can be a loss of posture, and it is important that we appreciate these attacks, and it is important to seek medical attention when a patient has these attacks. So loss of consciousness may or may not always be there. So it is important that for any of these episodes or ictus that we usually call, it is important that we get medical consultation. Now, apart from this, whenever we give a diagnosis of epilepsy to a patient, we have to understand that it is a diagnosis which has got societal, educational, economical implications, because the patient's driving gets restricted, his or her social life may get restricted. So we have to understand this aspect too, and we have to impress upon the patients that with good treatment, with a proper care and a proper plan of care, actually it is possible that you can lead a normal healthy life. There are certain taboos, there are certain societal misconceptions with epilepsy, and these need to be removed. Epilepsy is a disorder which can be treated very well with medications. The first choice of drug that we usually give in epilepsy is very, very important, and that is why whenever we initiate treatment, certain factors have to be dealt in mind: the age, the gender, the occupation of the patient, his or her compliance with the drug, and all those things, apart from the imaging features and the type of epilepsy. So it is always very imperative that when we start the medicine, we should be able to tell our patients that what are the common side effects, because this is going to be a long-term treatment, and what is going to be the plan if the drugs fail, because in 1/3 of the patients which we see, there can be a possibility of a drug-resistant epilepsy. So it is imperative that we plan it out with the patients. And apart from medicines, what other options can be given to our patients, like diet modifications. We have got the ketogenic diet or the modified Atkins diet, and even surgical options. So that is very important. And in the end, I would like to say that just like we have got the FAST acronym in stroke, for epilepsy it is important that whenever there is an attack, please do not panic. That is the first step. You are supposed to support the head of the patient. You are supposed to turn the patient to a side, and there are certain medications which can be given in a nasal spray form, which can abort these attacks. If it is available, if you can consult your doctor, they will be prescribing those medications. You can take those medications, and by giving that, the attacks can be obliterated. If you don't have that, still it's fine. Do not try to put anything in the mouth. Do not try to cover the nose or the mouth. That is very important. And just hold the patient, support the patient. Most of the times, within a few seconds or minutes, the attacks get aborted, and that is when you seek medical attention. So that is one thing that we need to know, and hopefully this spreads awareness in this World Epilepsy Day. Yeah, thank you.